This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Ionic XT Tablet is designed to combat iron deficiency anemia. It combines key ingredients to enhance your overall health. This medication is essential for individuals struggling with low iron levels. Indications and uses. This medication is primarily indicated for the management of iron deficiency anemia, a condition where the body cannot produce sufficient hemoglobin due to a lack of iron. It is essential for those experiencing symptoms such as fatigue, weakness, and shortness of breath, which are commonly associated with this type of anemia. Additionally, it plays a vital role in supporting pregnant women in maintaining healthy iron levels, ensuring both maternal and fetal health. Before starting treatment, it's crucial to evaluate medical history for conditions like hemochromatosis, which could complicate therapy. How it works. The combination of ferrous ascorbate provides essential iron, folic acid aids in the formation of new cells, and zinc sulphate supports immune function and overall development. Directions for use. Take this medication exactly as advised by your healthcare provider. It should be swallowed whole with a glass of water and must not be crushed or chewed. The physician will determine the appropriate dosage based on individual factors such as age, body weight, and specific health conditions. Adhering to prescribed directions ensures optimal effectiveness and safety. Possible side effects. Common side effects may include stomach discomfort, vomiting, diarrhea, constipation, and black stools. If any symptoms worsen or persist, it's advisable to consult a healthcare professional. Precautions and warnings. Prior to beginning treatment, it's crucial to inform your doctor about any underlying health issues such as hemochromatosis or gastrointestinal diseases. This medication is not suitable for individuals with unmanaged cobalamin deficiency or certain malignancies. Pregnant and breastfeeding women should also seek medical advice before use to ensure safety for both mother and child. FAQs. 1. Can this tablet be given to children? Consult your doctor for appropriate recommendations. 2. What should I do if I forget a dose? Take it as soon as you remember, but skip it if it's close to your next dose. 3. Is it safe to stop taking this medication abruptly? Continue until advised otherwise by your doctor. 4. Can I crush the tablet? No, it must be swallowed whole. 5. Are there any common side effects? Yes, including digestive issues like abdominal pain and diarrhea. Thank you for watching this video. We hope you found the information helpful. Please feel free to leave your questions or suggestions in the comments below.